Wow, I've just come in from from the cold. The guy who came in from the cold, I was chipping my car out of an igloo. But anyway, I'm here to talk to you about a public option, which I described fully on a website called www.the-public-option.com. And I think that this is the path to rescuing primary care. Primary care in America currently is quite flawed, mainly because of litigation. The primary care doctors have been reduced to functionaries in many cases who do little other than write prescriptions and refer patients. This practice and also this practice can cost the system $100 to $200 billion a year, unregulated referrals. And properly done, primary care would restrict referrals to those that are necessary, and only robust primary care practice could do that. The path to this salvation is through primary care centers of America. Why? Because litigation would be reduced due to the Federal Tort Claims Act. Anyone employed by the federal government will be covered by this act, and the defense attorney is the Attorney General of the United States. There's other advantages of distributing these centers throughout the country in adequate numbers. First, every citizen would be assured of the availability of primary care. The rates range from 0 to infinity, whatever you can afford. And if you have a crisis, or you think you perceive a crisis, or you need a doctor suddenly at 2 in the morning, if there's a primary care center available, you might choose to go there other than to the emergency room. Or if it's something frivolous, you'll go certainly to a primary care center. So as a result, through the advantages of establishing these primary care centers would be all Americans would be assured of the availability of primary care, but no one would be forced to go there. People could still get their insurance from the HMOs. Hundreds of billions of dollars could be saved through restricting referrals and decongesting emergency rooms, so that people who are now flooding the emergency rooms for minor problems could go to the primary care centers. And so for starters, those are two pretty good advantages. Lastly, I just want to exhort everybody listening not to get pinned down to labels. Public option, it's socialistic, it's the government encumbering our lives. It's ridiculous. We're going to have to learn to deal with things on an item-to-item basis, on their individual basis. And if we don't do that, we're doomed. Then we're going to get married to slogans. And if we're married to slogans, we're unable. The slogan is a cloak that's put over the issue, so you're unable to see what the issue is. So please think clearly, listen to this, go to the website, and hopefully it'll clarify some issues and make the public option no more than 2 words: a system that's public and a system that you can go to if you want to. And maybe we should take the word option out and just say a public go there if you want. Okay, thank you, and I'll talk to you again in the future, near future.